Hi guys, you're welcome back to this Facebook channel, and today we'll be talking about another pharmacological tip and trick on nursing responsibilities. Most time nursing responsibilities is actually one of the subheading that gives students problems. After writing about 5 to 6 heading, you write the classification, the dosage, the mechanism of action, the side effect, the contraindications, and now you want to write the nursing responsibility. Oh, how do I write the nursing responsibility of this drug and that? So today, in brief, we'll be talking about nursing responsibility under a certain type and class of drug. So we are actually looking at nursing responsibilities of all drugs that fall under a category. And what are the category? Every drug that falls under the category of drugs that depresses the central nervous system, you can actually use the same nursing responsibility for all the drugs. And when I mean drugs that depress the central nervous system, they are broad and they are wide. You have many classes. Let's talk about the anti-epileptic drug, the psychotic, anxiolytic, the opioid analgesic, the narcotic, therapeutic drug, psychotherapeutic drug, the moxu relaxant, then tranquilizers, hypnotics, sedatives, and what other class? Okay, we've talked about the antipsychotics, anti-epileptics, and anesthetic. Yeah, thank you. Anesthetic, either general or local. I've talked about 7 to 8 classes of drug. Any drug that falls under this classification, you can actually write the same nursing responsibility for the drug. So that means if you are presented with diazepam in your exam, and diazepam number 1, number 2 that's Modicate, number 3 pentasucin, number 4 bupivacaine, they fall under different category. One is pentasucin is opioid analgesic, is a narcotic. Bupivacaine is an anesthetic agent. Diazepam is a muscle relaxant. Then what was the other one that I talked about? Okay, so if you are Modicate is an antipsychotic drug. So if you are presented with different classes of drug, in as much as you know that these classes of drug fall under the drugs that actually depress the central nervous system, you are good to go. Okay, so let's go to the nursing responsibilities in proper. So how do this drug, how do they work? Actually, this drug might not actually have the same drug chemistry, but they have the same pharmacological effect. They actually work by depressing the central nervous system, and when the central nervous system is depressed, it causes relaxation, it causes an elevation of mood, it causes an allay in anxiety and fear, and it reduces tension. That's why it is being administered. Anesthetic, talk about anesthetic, it's what does it do? It causes immobility, and it's what depresses your CNS. It causes your what it your reaction to pain, your reaction to pain. It causes hypogeusia. So talk about antipsychotic, talk about opioid analgesic. When you take them, you have this feeling and this sense of feel good in your brain, in your system. Okay, so that's how it works. So if you should see any question that on any drug that falls under this class, you can write the same nursing responsibility. And how many nursing responsibilities will I be talking about today? Just 5 or 6 or thereabout. So the first nursing responsibility that you as a nursing student or a nurse you have is that you are saddled with is to what? Ensure that the patient vital sign is within the normal range. And what fighters am I talking about? All fighter signs are fighter. That's why there are signs that are fighter actually. But the one we are talking about on drugs that depresses the central nervous system is the respiration. So you should know if your patient's respiration before the administration of drug is within the normal range. you should know, you should note that, because that is a pointer to why you should not give such drug. Because drug that depresses the central nervous system, every drug that falls under the classes, hallucinogen is also one of the drugs I like to talk about that fall under the class of the one I have mentioned earlier. They are capable of causing severe respiratory distress. Severe respiratory distress. That's why you see in the theater most times when you administer epimacaine or anesthesia, before you even administer opioid analgesic to patients, you see that their fighters begin to what? Dwindle. It begins to reduce. It begins to reduce, and you see that their respiration most times begins to reduce. So you do not want your patient to fall into respiratory distress. That's your first nursing responsibility. Your second nursing responsibility for all these drugs is you should ensure that your patient has been fed. That means you should not administer these drugs on empty stomach. These drugs are not just mere drugs. They are not like the classes of antibiotics that you can administer on empty stomach. No, you cannot administer this drug on empty stomach. So that's the second one. The third nursing responsibility is that after administration, you make sure, or let me use the word, you ensure and you educate your patient that they should not handle heavy machinery. Or if your patient drive, or if they drive themselves to your place of work or where you've administered it, you ensure that they do not drive themselves back home after the administration of the drug, because these drugs are capable of causing what? Instant dizziness, fatigue, loss of consciousness, syncope, esophageal syncope, and death, instant death in severe complication. So that's the third nursing responsibility we've talked about. The vital signs, it must be in the normal range. Your cycle per minute, that's your respiration, must be in the normal range, and other vital signs as well. Then you must not give these drugs on empty stomach. Make sure that the patient has been fed. Then number 3, you talk and you ensure that your patient does not handle heavy machinery. It's not that you give this drug and you tell your patient, you can go and handle that generator, you can go and handle that heavy machinery again, you can drive, you don't have problem, you can cross the road. No, you cannot do that. Then number 4, this one is also vital. You make sure that these drugs are administered on the right site. Site as in SITE. And I know that we know the R's in nursing: right route, right name, right patient, right all those things. But number 4 responsibility is that you make sure that these drugs are administered on the right side, stroke right route. Now, most of these drugs, most of them have tablets, most of them fare the oral route, but most are doubled, most have tablet and injectable form. Most are given in the injectable form. For those that you want to give in the injectable form, you make sure that it is on the right side. And where is the right side? Okay, let us branch into the right side of the of where you inject in the body. If you are using the gluteal region, you know that it is the right upper quadrant. So you don't actually give on your ischial tuberosity or give directly. And when you inject, you withdraw back to see if there is blood, to know if when there is blood, you are not on the right place. If you inject on that place, the patient is at risk of sciatica, paralysis, paraplegia, quadriplegia. The patient is at risk of contractures. These drugs that fall under these classifications have actually, over the time, they have caused contractures. And what do I mean by contractures? You see the patient's gluteal region, it is not smooth. It's like a filly. It's like heels and filly. And when you touch them, you can feel it like a post-injection abscess. These drugs are capable of forming post-injection abscess, and and contractures if not given on the right side. If not given on the right side. So that's number 4. Number 5, which is also vital, is that you counsel the patient on the use of this drug and its danger of physical and psychological dependence. This drug over the time have been noticed to cause physical and psychological dependence. Patients over the time depend on this drug. And when they don't see this drug, you start seeing they start feeling jittery, they start misbehaving, because what, their central nervous system, the brain, has actually, and the body system is adapted to this drug. So it's adapted to this drug. So they are at risk of physical dependence and psychological dependence. So that's your fifth nursery responsibility. You talked about, you lecture, yes, let me use the word lecture. You lecture the patient on physical and psychological dependence and drug tolerance. They are patient, for example, HBSS patient. Pain is inevitable for them. But in lecturing them about drug tolerance, if they come to your clinic to take opioid analgesic, you tell them, oh, what if you have pain some other time and you decide to sleep? Sleeping is the first natural method of taking away pain. If you sleep and when you wake up, pain will have disappeared. So most times you will not need to take opioid analgesic, and most times you will not need analgesic that are as strong as opioid. So that's the fifth nursing responsibility. So let me recap. The first one, I talked about the vital sign. You as a nurse should make sure that your patient vital sign is stable. Respiration is important because these drugs have been said to cause respiratory distress. Number two, I talked about how you should not administer this drug on empty stomach, either via the oral route or via the injectable form. Number three, I talked about how you should lecture your patient and ensure, not only lecture, you make sure that they do not handle heavy machinery, they do not drive themselves back home, or they do not go back to crossing the road and all the likes after administering these drugs to them. Then number four, I talked about how you should give these drugs on the right side for the injectable form, because most of these drugs have been reported to cause post-injection abscess and contractures. Then number five, I talked about how you should lecture your patient and ensure you lecture them on physical and psychological dependence and tolerance. So these five nursing responsibility can actually earn you 10 marks in your council exam, and I don't know about the module for your school exam. It can earn you as more than 10 marks as well, because they are actually detailed. So for any drug you see that falls under the classes of drug that we mentioned earlier, if you are just joining, we talked about the anti-epileptic, antipsychotic, we talked about the psychotherapeutic drug, we talked about the hypnotics, the tranquilizers, the sedative, the narcotics, the opioid analgesic, hallucinogen. So when next you see a drug, let's say diazepam, Valium, same thing as diazepam, pentazocine, naloxone, hallucinogen, Modicate, all these drugs that fall under this class, you can write these five nursing responsibilities that I've said. So you do not need to write this nursing responsibility on antipsychotic, and when you see another drug that falls on muscle relaxant, you go and write another nursing responsibility. These nursing responsibilities that I have given us can actually work for all the classes of drug that depresses the central nervous system. So that's that today. Thank you for staying tuned. Let us know what you feel in the comment section. Don't forget to like and don't forget to share to your colleagues at school and at work. Thank you for staying tuned. Don't forget to like our page as well. Thank you for staying tuned once again. God bless.